how do things change? Yeah? So when does change happen, and what are the properties of the moment of change, basically? And we develop methods for that we then use, and we apply it to real systems that change. And a virus is exactly that. We can take samples of those viruses. We can find them in people, isolate them, and then look at their genetic properties. And that is where we come in and say, okay, can we apply our method and apply it to that to understand the change of the virus and its spread over time? If we have a case where we have already 15,000 people infected, 20,000, 30,000, but we have like 50 samples of the actual virus from those places. So that means we have very little data for a large-scale phenomenon that basically spans the globe. What does it mean? It means we have holes in the data. If I have data holes, so I take a sample from a patient that was detected in China, and then there's another patient that it was detected in the USA, how do we now find out that actually there's this path between this Chinese patient to the US patient? The way we do this is by looking at genetic similarity of the probe that was taken. Then our approach will create a strong connection between these two, indicating that, okay, this is a similar viral sample. There is potentially a pathway here, and that means people can now go and investigate deeper qualitatively. Has that person actually visited a place? So is that the actual outbreak sequence of the virus? A lot of statistics focus on stuff that is really, really frequent, and the underlying statistical idea of our analysis method, Transcendental Information Cascade, is that it actually allows you to also capture what's really rare, but has an impact on change of the overall system, because sometimes that's exactly what it is. In lay terms, people call that the butterfly effect. Our aim is to continuously update our analysis and provide the results to the general public, because ideally that becomes a tool for people to understand the outbreak better and helps answering those questions from where do we need samples. And if that then rolls over in this becoming a standard tool for epidemiologists to use even in future crises of this kind, that would be a fantastic outcome of our work.